to Conspiracies Against Wellness with your host, Janelle Elgaway.
Good evening. Welcome to Conspiracies Against Wellness. I'm your host, Janelle Elgaway. If you have a question or comment for this evening, please call in at 415-915-2291 or call 1. Or you can listen in and comment or question live stream on our YouTube channel, which is Conspiracies Against Wellness live stream. Tonight, we are talking about circumcision. Circumcision was imported to the USA in the late 1800s as a cure for a variety of reasons that today we find laughable and truly disturbing, such as masturbation prevention, insanity, and imbecility treatment, even tuberculosis and paralysis. Since then, circumcision has claimed to be a preventative treatment for a variety of other conditions, since also rejected by American medicine. During these years of circumcision became deeply socially entrenched through a campaign of demonization, stigmatization, and conformity. Circumcision was sold as a status symbol of wealthiness. Today, our physicians receive practically no education on the many structures and functions of the foreskin. They give informed consent without being informed on the healthy, natural body part they wish to amputate from a non-consenting infant. Physicians often use hard sell techniques to pressure new, vulnerable parents into agreeing to circumcise for a fee. Circumcision of infant boys is both extremely painful and traumatic for an infant. It robs an adult man of his right to bodily choice. So tonight, we have Justin on. He is an RN. He is an educator and advocate. Justin, welcome to Conspiracies Against Wellness. How are you doing this evening?
Thanks, Janelle. Thank you for having me. Doing great.
Great. So can you tell us a little bit about yourself first?
Sure. I went through nursing school in 2004. During that, we have a maternity rotation, and the students are invited to witness circumcisions. They will have you maybe come in to see several. I was invited in, and I went inside. The baby was taken from the mother. He was brought into a small room with soundproof doors. The baby was then placed onto a plastic circumstraint, which looks like a plastic board with the baby spread eagled. The baby's then strapped down by the arms and legs, the diaper's removed, and at this point the baby starts to become agitated, and then the procedure begins. And what happens is they clean the area, and they started to apply clamps to the tip of the foreskin. And at that point, the baby started to give the most haunting wail I've ever heard. And I immediately was thinking to myself, I thought babies, slept through this procedure. I thought this was no big deal. And it was just absolutely agonizing for the baby from the very beginning and for about 10 minutes. And during that, the baby screamed in the most horrible agony I have ever seen. And it eventually went unconscious during the procedure and was then brought back to the mother. And the baby is now fast asleep. Mm-hmm. And they said, oh, yeah, he slept through the procedure, when in fact he was just so incredibly exhausted from crying for so long in so much pain that he went unconscious.
Well, and
that's what I've learned since is the circumcision sleep.
Yes, and we are going to go into detail much more into this. I believe we have a video that you have asked us to listen to. It's the audio of this. Would you like to give a preference to it?
Yes. What you're going to see is in a normal American circumcision. In this video, the father requested to be in the room to be with his son during the procedure, and he had a friend videotaping it. So what you'll see is the doctor begin the procedure, and just like with what I saw, as soon as they begin to attach to clamps, you'll hear the baby scream. And from that first time he screams is right when the procedure begins, and it's obvious the baby feels absolutely everything.
Okay.
And it's a very disturbing video. I would like to warn the audience that the baby screams in agony, but I want you to think of this. If you cannot bear to hear this on your radio, in your house, sitting in your chair drinking coffee, how can you ask a brand newborn to actually endure this agony for silly social reasons?
Yes, I agree.
Let's listen to what this baby does.
Okay, well, here we go. We're going to listen to the first part.
At this point, the doctor's just preparing the area.
Okay.
The baby's not crying. He's very calm.
So is he being put into the chair right now? It's not even anything yet? He's just being uncomfortable, right?
Right. At the beginning of the procedure, they will put the baby into the circumstraint.
Is that what?
So he can't. That's the plastic board that's shaped like a baby. So he can spread eagle the baby, and they strap down his arms and legs. And they strap them down very tightly so they don't move at all during the procedure.
Okay, they're talking about it.
And they.
Hang on one second.
Down, here, right down to that level that you're talking about. No, that just crimps the whole thing.
Are they doing it right now?
Guys, yeah.
That's it for just a moment.
Is the audio playing?
Yeah.
Release his arms so he feels less.
Brian, is that going over? Yes, it is playing.
What's that?
As a way that you'd use it for anesthetic?
We mix into the mixture here the stuff that takes the edge off here, okay? And
Okay, so were you able to hear it? It was the first part of the audio that you gave us. And
Okay.
Okay, so you could tell when he was getting in the chair. So you know the first audio that you were going to give us that we were going to play first, right? And was he actually getting it, or was it just he was being strapped in? And then I could hear he was.
The baby, did the baby begin crying?
Yes.
About 10 seconds in?
Yeah. Yeah.
Okay. Yeah, I wasn't able to hear it. But if it stops at about the 3-minute mark, has the baby been sounding extremely distressed?
Yes.
Okay.
It was
So
crying, and
around
I could hear the gurgling on its like phlegm almost.
Yes. Okay. At that point, what's happening is the procedure, the baby cries like that in reality for about 5 minutes. Now, we've edited it for the sake of the audience. But the baby is in extreme agony, and the doctor is completely not concerned. In fact, he keeps trying to pacify the father, who's becoming, very upset and agitated himself.
Yeah.
Now what you'll see in the second part of the video is the baby's making a gurgling sound. He's full of phlegm. Still zero concern from the doctor, who just continues to mutilate him. And towards the end of the procedure, the baby has lost his ability to cry. He just makes a gurgling whimper. And at that point, he will fall into the circumcision sleep and be brought back to the mother. And he will be out unconscious, sleeping for many hours after that.
Okay.
Because that's the response. That's the infant's response to trauma, is they withdraw inside.
All right. Well, let's play part 2 of that now.
Settle them down. yourself upset. I think Daddy's getting excited. No, we're getting excited, Dad. We'll be okay.
All right, I couldn't even handle it. I'm crying. Wow. That is so bad.
I've been an EMS worker. Volunteered my time at Ground Zero. I've seen people, shot, people crushed in vehicles, and that video is the most disturbing thing I have ever seen.
Yeah.
And I truly believe if we did that to Osama bin Laden, the entire nation would be outraged at how we were torturing him. But somehow this is acceptable to do this to our brand new baby boys.
Yeah.
And the reason it continues is because it's been hidden in the darkness. Nobody talks about it. Nobody exposes it. And that's why shows like yours are so great at stopping this.
Yeah. So what is circumcision? What is it? And actually, let me ask you something quickly. What is the correct term?
Sure.
Because I know I've heard uncircumcised, or, I mean, if you're uncircumcised, it's basically you're already talking about something that's destroyed and you're cutting off a penis. So why are we saying it uncircumcised? What's the actual term for that?
I describe it as an intact penis. If we lived in a normal world where we did not cut off parts of the body, I would just say that's a penis. Okay. That's just part of his penis, But if you're going to start cutting parts off, then you would say, Janelle is unmastectomized because you still have your breasts, right. Like anticipating you're going to want to have your breast removed. They do that because it normalizes the procedure of circumcision to make it seem like every man is just waiting to be circumcised. Okay. But I call it intact, and that's the common term that's in usage today.
Okay. So what is a circumcision?
Circumcision is the removal of the specialized tissue at the end of the penis that covers the head, and the amount removed varies wildly. Some circumcisions remove a very small amount of tissue. Others remove upwards of 60% of the entire penile skin system, 60% of the penile muscle system, and roughly 75% of the penis's erotic nerve endings.
Okay. What is the foreskin?
The foreskin is the tissue that covers the penis, the head of the penis. It is a double-layered fold of skin that can retract. When the man becomes erect, the foreskin naturally will retract, exposing the glands, which is, an evolutionary sign of arousal. It protects the head of the penis, and it serves as a gliding sheath during sex. So both partners have comfortable intercourse. In America, lots of women complain of having issues with vaginal dryness, and the doctors will blame them and say, you're not aroused enough, or you have a hormone imbalance. But in fact, the problem is that they're having sex with a circumcised man who draws out all of the lubrication because the penis is designed like a squeegee when it's circumcised. When it's intact, all of the fluid stays inside, and so sex is as nature intended it.
Okay. Wow, I didn't know that. Why are Americans so obsessed with cutting the foreskin off and getting their baby boy circumcised?
I believe it's because it's become so culturally ingrained in us. We've grown up hearing all negative things about the foreskin, and all of which are essentially untrue. We grow up, hearing that uncircumcised boys, or intact boys, as I say, will get bullied in school. So we say, we should, operate on our children to appease some silly bully in junior high school, which sounds ridiculous to me. We do it primarily also because the father is circumcised. And to not circumcise the son would make the father start to think that he's actually missing something of value. When he was born, he lost something, and that involves the man's penis. And men are very protective of their penises and their image. So it's a deeply psychological issue for men.
Even if it's their
and
son?
And the women, even if it's their son.
So is there like penis envy for a father and son almost?
Yeah, well, for a circumcised man to realize that he doesn't need to circumcise his son, that it's an important part of his body, and he sees it every time he changes the child's diaper, it's always something he might be thinking about. Right. Now, some fathers, of course, will say, no, I don't want to do that to my son, but we have this thing we see called the adamant father, who absolutely refuses to listen to any type of education and is just dead set on cutting, and, that's it. He's going to cut. He doesn't want to listen to anything anybody has to say. Because his son's penis is going to match his penis, which seems as bizarre as anything I can imagine. That if you want your child to match you, I would say to buy a matching sweater or to buy a matching pair of jeans,
right? Not
to operate on your son's sex organ so you and an infant have matching sex organs. That is just completely bizarre.
So when a baby, because I've heard some myths that babies don't feel pain. Is this true?
Babies, like the example in the video, babies actually have a heightened sense of pain, and they feel the pain exquisitely, especially with the circumcision, where you're operating on the most sensitive part of the human body, of that boy's body, which is his foreskin. Americans have been misled to think that the foreskin is the extra tissue at the end of the penis, like it's redundant tissue. It's not. It's, in fact, the most specialized erotic tissue on the penis. It contains, the outer foreskin is just normal tissue, like your regular skin on your body. But it folds in on itself, and it has what's known as a rigid band, which is a densely innervated part of the penis that, when retracted, forms ridges behind the head of the penis. And that has a very good evolutionary reason, because it stimulates the woman during sex. And in fact, Trojan condoms, they make ribbed condoms because they're trying to replicate that function that is lost to circumcision.
Makes sense.
Also, that rigid band, when it retracts, every time it retracts and moves forward, it fires Meissner's corpuscles nerve endings, which produce that really pleasurable sensation during sex. And it connects to the frenulum, which is the tether under the head of the penis. And most people are aware of that, even in the United States. That spot is the primary orgasmic trigger on the penis. And intact men can orgasm simply by just touching that one area that is removed during circumcision.
Okay. So I want to go more. So, by the way, we're having part 2 tomorrow, and we're going to, tonight it's more about the myths, what is circumcision, how it's done, and stuff like that. But then we're going to go into more of why it's done and the motives behind it all, and what can we do about this? How can we change things? But I do want to ask quickly, what are the motives of these doctors, just in a quick summary, that we could touch on for tomorrow and kind of let people know?
Sure.
Yeah.
American doctors and nurses, we receive practically no education on what the foreskin is, what its functions are, what its anatomy is. The only training doctors are given is how to amputate it without, the baby bleeding to death or something.
Uh-huh.
And so they have no information, essentially, and I've asked many of them. They do not know anything about the structures and functions of the foreskin. So there's no way they can give informed consent to a parent if they can't explain what the purpose of the body part they want to amputate is.
Right. Okay. So let's start in the beginning. So what exactly happens when a mother is going into birth and she's about to have her baby, say it's a baby boy for our case tonight, and she has the baby? What happens after that? I want to know, what do doctors do? What do nurses do? What's the parents' stances on all this? What's the baby's stances? Let's go from each point of view.
Sure. The doctors have been trained to perform this procedure, and pediatricians and OBGYNs, primarily in the United States, they know that this is a procedure parents really want. even if they try to dissuade them often, the parents will just go find a different doctor to do it. So doctors have learned they just go along with the parents' request to cut the baby for the social reasons, to match the father, or because the mother's never seen an intact penis. She's heard it's dirty or gross, even though she's never seen one. And so the doctors just agree to circumcise the baby and to keep the parents coming back to them instead of going to find somebody else.
Well, and they make money too.
They make money. Every baby boy in the United States is essentially born with a $300 coupon on the end of his penis.
Wow.
And all the doctor has to do is cut it off.
Wow. So what's that, like $1 million over your lifetime if you're a doctor doing circumcisions alone? Something like that, right?
I interviewed a physician who'd been practicing for over 50 years, and just doing a rough estimate, I think he probably made close to $500,000 over his career performing circumcisions.
Still, I mean,
and in fact, that man was the doctor was misdiagnosing every single baby boy he had, saying that the child needed to be circumcised because he was born with a normal penis, which I can explain later.
Okay. So, all right. So as an RN then, speaking from your term, okay, so a woman has her baby. It's a little boy. What happens? Do they teach you how to kind of coax or work together to get the mother to have the circumcision? And then what happens from there? Please go into detail.
Well, yes. If any nursing staff, for instance, when they speak to the parents, they know they're not to try to dissuade them against circumcising, because they would be costing the doctors that they work with a great deal of money. And so that's a possible motivation for some of the nurses, of course. You don't want to, anger the physicians you work with.
Right.
They are supposed to be the ones who give the recommendations about what's best for this baby. But yes, so they will not be giving an informed consent. You won't be getting normal nursing education.
Okay. So do you actually work in tandem though? If a mother says, I don't want my baby to be circumcised, I mean, do you guys? Okay.
Yeah. Well, often it's a hard sell technique.
Okay.
They will have a nurse come in and say, in a very matter-of-fact way, so when are we having the circumcision? Is that going to be today or tomorrow? Already implying often that you're going to have your baby circumcised. Like there's no question about it. They're just trying to figure out what day do you want it. And so parents will just be caught in that. If the parents say, no, we're not sure about it yet, the nurse will go away, and then somebody else might come in and again try. And if the parents still say no, they try a variety of techniques. They'll say, "Oh, your son will hate you if you don't do this."
Really?
He'll never get a girlfriend. Not all the time, of course, but it depends on where you go. In my experience, I've heard so many stories about these hard sell techniques with brand new young mothers, and they don't know anything about it.
Yeah.
They trust the doctors and nurses, and they don't know what's the motivation, possible motivations behind it.
Is it often that a parent or the parents know what they want beforehand, and do they know or no?
Typically what happens is the mother will defer to the father on this issue.
Okay.
It's one of the strangest things.
Why,
a mother
why do you think
having
that?
a brand new baby
Yeah.
will defer to the father, say, well, he's the one who owns a penis, so I'll let him decide. And so the mother lets some arbitrary choice decide if her child needs surgery and amputation on his sex organ, which is totally bizarre. Normally, mothers would be very involved in, all of their child's medical care.
Yeah.
But not in this case. In this case, they don't want to offend the father's, they don't want to mess around with his psychology. Because they realize if you say, no, I don't want to do this, the father might get very offended. He might take it personally.
Right. So is circumcision done in front of the parents, normally?
Usually not.
Okay.
Usually the baby is taken into a separate room. Often it's soundproofed. And the staff will try to get the parents to go get a cup of coffee. Here's a couple bucks. Go get a cup of coffee. Come back in a half hour. Everything's going to be fine.
Is this like one baby at a time? Do they do how does this, do they line them up? What
what they often do is if there's going to be several babies that need to be circumcised, if there's several babies that are going to be circumcised by these doctors, they'll often have 3 or 4 circumstraints, and they'll get the babies together, and they'll just do them one after another.
Wow. Now, do you
It
guys...
depends on if the doctor has many patients.
Before we came on, I had a friend that said, I paid extra to have my son, they put something on his penis so it didn't hurt him as much. And I said, well, can you explain that? I want to know, do we put any pain things on them? I know my producer mentioned about having nerve blocks done. Tell me everything that they can have done. Does it actually work? Why does this go on?
Sure. Well, today, there's a few techniques that they attempt to use. One of them, the first technique that's often used, is simply a pacifier dipped in some sugar water. And it's like a prescription sugar water of 30% glucose, but it's just a little Coca-Cola. They put it in the baby's mouth.
Okay.
Yep. And then they'll tell the parent, well, this will release endorphins so the baby won't feel pain. But, of course, everybody in reality knows it's just part of the show.
Yeah.
It doesn't really do anything for the baby for this type of a procedure. Maybe if it was some very minor, a blood draw or something, maybe it might work, but not for a circumcision where the pain is continuous and agonizing for 5-10 minutes.
Yeah.
Then
how long is
another
it exactly?
Technique
is it 15 minutes or 10 minutes?
The whole procedure, it can take 10-15 minutes to perform the whole thing. Probably about 15 minutes.
Okay. All right. Okay, go ahead.
Yep.
All right, so
also
the glucose...
they will use...
Go ahead, yeah.
There's also many doctors who do not use any type of anesthesia will say, well, I circumcise very quickly. That's my type of pain control.
What's quick?
Do it really quick. Quick would mean, often with religious circumcisions, they do a different technique where they kind of can do it very fast. They rush and they cut.
Why wouldn't you do it
so
for all
they will
babies?
Claim it's slightly quicker.
Uh-huh.
They use a device that has had issues in the past called a Mogan clamp with cutting off part of the head of the penis sometimes. So American medicine doesn't use that device.
Yeah. Well, and may I just say something quickly too? Wouldn't this be the equivalent to a adult male getting the same thing done? It's the same thing, right?
Well,
like you're going to feel the same pain.
It's actually they will say, oh, it's better to get your child circumcised when they're a baby and they can't feel pain and they can't remember it. But in fact, it's much worse in many ways to circumcise an infant because the infant is taken, he's strapped down by his arms and legs, which by itself is terrifying.
Right.
He's awake. He is not put to sleep. He's not under any type of anesthesia. The baby endures. And I mean, that word is so important. It lives through and it endures that torture. And that will have an imprint on anybody, even a baby. But then the baby is taken, he's cleaned up, he's given back to his mother. He's not given any type of pain medication. He won't get any Percocets or anything like that because it's not safe to give babies those type of medications. So he's just going to have to live with his pain. There's no, the doctor might say, I'll try some Tylenol, but Tylenol doesn't work great when you have amputation on part of your penis.
Right.
But then every time the baby urinates and every time he defecates, he's urinating and defecating on an open wound on his penis, which is agonizingly painful for several days. So every time the baby pees, he's again in agony. He's again in agony. At that point in life, the baby's job is to simply learn to breastfeed and learn how to bond and love with mommy and daddy. But in the United States, we instead teach the baby how to endure the worst type of torture you could imagine. That's, in my opinion, worse than anything ISIS or any other, group could possibly invent.
Let me ask you before I want to go into something else. But how did you react the first time you experienced watching a baby being circumcised? What was that like for you?
It was shocking. It was almost like it was the most disturbing thing I've ever seen, and I've seen quite a bit. And what was the most disturbing is the dead emotions of the people performing the procedures, because they have zero empathy for the baby's screams. It's not, normally you see a baby screaming, you'd want to hold it, but no, they know that this is what the procedure is. They know the baby's screaming in agony, but they're getting paid to do it, so they're going to continue to do it. The parents have asked them for it, even though parents are not allowed to ask to cut off any other part of the child's body. If it's a boy, if it's a girl, you can't say, let's pick and choose what body part we want to amputate, what healthy body part. That's not ethical.
Right.
And in Europe, this procedure is considered unethical and barbaric. In fact, the American Academy of Pediatrics, or the AMA, I'm sorry, American Medical Association's own ethics journal has published a paper saying that circumcision of infant boys might be unethical because you're creating, injury to the penis. And the child did not consent to this. It's irreversible, and it's not treating any condition, and it doesn't follow any of the tenets of modern medicine.
Well, hey, Justin, we're going to take a quick break, and we'll be right back.
Got something to say? Get in on the conversation at 415-915-2291. That's 415-915-CALL-1.
Welcome back to Conspiracies Against Wellness. I'm your host, Janelle Elgaway. We are here with Justin this evening talking about circumcision. So we were just talking about,
methods of pain control.
Yes.
And now, with modern medicine, this was not around when I was born, when I was circumcised, or any of my peers. We all went through what the baby in the video went through. Today, they will use a topical anesthetic called EMLA cream,
okay.
Which its own packaging says is not to be used for circumcisions because it's not effective. The doctors will apply this in an off-label status to the foreskin and then do the circumcision. Now, the foreskin, as I said, is a double-layered organ, and it's highly innervated. The EMLA cream will just numb the very top part, the normal skin part of the foreskin that is not extremely sensitive. It does not do anything for the inner foreskin at all, or the frenulum, which is, the frenulum is, roughly equivalent to like the very pleasurable parts of the clitoris where it attaches. It attaches to the gland, so the whole penis would be equivalent to the clitoris and a foreskin. So in circumcision, you're removing what would be equivalent to the hood of the female clitoris and to its frenulum that connects it, which is one of the most pleasurable parts of the clitoris. So your circumcision's whole design was to remove as much erotic tissue from the penis as possible.
Okay. So now we've had the circumcision done. What happens after that? I mean, is it easy to get infected? Can staph lay in? I mean, what is that like? How is a mom supposed to take care of that? And I do want to ask, too, the myth on, if it's not circumcised. I want to know about that, too. But let's go first into circumcision if it's done already. Is that easy to...
Sure. Well, no, it's so much harder to care for than an intact penis. When you have a baby with an intact penis, all you do is keep your hands off of it. If you dip your baby in the tub, that's fine. His penis gets cleaned. You could do a little bit of stroke from base to the tip with just a wet cloth, and that's it. You do not have to try to pull back the foreskin because at that age, it cannot be retracted, and it's fused to the head of the penis.
Okay.
Because the baby's diapered at that age. Nature does not want the child to be defecating all over his penis every day.
Right. Okay. So what about later in life? Because I hear, I think somebody had a question the other day about saying that when my son was 19 years old or something, they got infected, so they had to get a circumcision then. What do you say to that?
Well, I say that's first it's a very uncommon occurrence. Only about 0.4% of men would ever need a circumcision. It's about 1 in 2,000.
Okay.
I would say, first of all, he got an infection. What was the problem? And they'll say, his foreskin was too tight. The reason his foreskin was too tight almost every time is because the mother was retracting his foreskin, attempting to clean underneath it when he was an infant and a young child, because she was given incorrect care instructions. The correct care instructions are just leave the penis alone, and the baby's going to be fine. You will never touch his foreskin. You never try to retract it because that causes damage.
Mm-hmm.
If you try to retract it, you tear the opening, which is very delicate at that age, and you will rip it from the head of the penis where it has a connection like your nail is connected to your finger. That separates over many years. In Europe, studies have shown that the average age of a child being able to retract his foreskin is 10 years. So a 10-year-old will at some point be able to retract his foreskin. But in all that time, you do not need to worry about cleaning underneath it. It's nothing. The penis is self-cleaning, just like people say the vagina is self-cleaning. It requires no special care. Okay. Now, if you asked about a circumcised infant, yes, now you're cleaning feces out of a wound, which your baby's going to be screaming at. A normal infant, you clean its penis, he doesn't feel any pain, but a circumcised penis has a fresh wound. And now the mother has to take care of it after every diaper change. She has to put on antibiotic ointment. You have to put on you have to glob Vaseline over the head of the penis at every diaper change so it doesn't stick to the diaper, and so you do not get a condition called meatal stenosis that happens from circumcisions where the pee hole becomes extremely narrow. Now, also, when you have a circumcised boy, you also have to retract all the remaining foreskin at every diaper change. And so you're pulling on the open wound, which is very painful. And they do that so the foreskin will not heal itself to the head of the penis, because you've not only cut off the foreskin and created a wound there, you've also torn the foreskin off the head of the penis, which tears off the top layer of the head of the penis, and they can grow together. So it's actually very complicated, and new parents are often horrified by the look of the child's penis. And they often say, is this normal? Is this normal? They'll share pictures in parenting groups.
Right.
And it's, the amount of tissue removed varies wildly. Many parents will say, I have one boy who has nothing, my other boy has a lot.
How long does it take for a baby to heal once they're circumcised, normally?
The healing process, until the baby is out of pain, I would say, that takes probably, about 5 days. There might be pain afterwards when the mother has to retract the foreskin after every diaper change, the little remaining foreskin. So it's a constant thing, and often doctors recommend to glob the Vaseline on it for the first 6 months of life up to maybe the first year of life. So it's very complicated. It's a lot of work. And so the myth that circumcision makes the penis easier to clean it's one of the biggest lies ever. I mean, cleaning an intact penis, there's another myth that parents will say, oh, I circumcised my son because, I don't know how to clean it, or because when he becomes a teenager, he'll be too lazy and stupid to clean his penis.
Yes, I've heard that.
Like he just won't want to clean it. And what I always say is, a teenage boy vigorously cleans his penis at every shower. You can't, you know what I mean? You can't stop them. There's no issue with them retracting their foreskin and cleaning it. I mean, it's the most absurd thing ever. It's the most simple process to clean an intact penis. It takes 5 seconds. Since we like to amputate the foreskin in America, we create these myths that it's impossible to clean and that human males are too stupid to learn how to wash their own penis. I mean, it's just absolutely laughable when you start to actually analyze how we do it and how we pressure other people to. I've heard people say that they circumcised their son for that one reason, because he'll be too stupid to do it later.
Yeah. Or they'll be made fun of. I've heard that before too, because
it's different. Right, yeah. Or they'll be made fun of. That's a great one too.
Yeah.
They say, well, I circumcised my son because I don't want him to be made fun of in the shower.
Right.
So let me get this straight. You operated and amputated part of your healthy infant's penis because you're concerned that some junior high school bully is going to make fun of him? I say, why don't you just teach your son that he's the lucky one and that the other boy has a damaged penis?
Yeah.
You could respond like that if you ever get made fun of. And then the child will be like, oh, I'm very lucky not to have been circumcised. And he won't be ashamed or be getting bullied if you teach him properly. I mean, that's an absurd reason. I never knew we operated on people, on children, because we fear body shaming.
Right. Body
shaming is something that we want to eradicate, not surrender to by operating on children.
Can a baby die due to circumcision? And I know there's a main artery that there can be issues with when they're cutting this. Can you explain all of that?
Certainly. When you amputate the foreskin, like I was saying, is extremely specialized neurological tissue. It's sensitive in parts like if you were to touch your eyelashes, that same sensation, an extremely sensitive touch, or your lips, or the palm of your hand. It's very, very sensitive. Excuse me. So yeah, so when a circumcision is performed, that structure called the frenulum on the underside of the penis, which everybody is aware of, the magazines like Cosmopolitan and the other female-centered magazines often talk about, stimulate the frenulum during oral sex. The guy will love it, and they go on. They don't mention that your man might not have a frenulum or any remnant of it, so he won't, enjoy that type of technique at all because his parents circumcised him. But what that structure is very densely innervated tissue, and it has an artery. So an artery goes from the body of the penis into the frenulum and into the head of the penis. And that artery feeds the underside of the head of the penis and the urethra. So it's an important artery. And when you sever it, that underside of the head of the penis loses its normal blood flow. So it doesn't develop properly, and it leads to a condition often called meatal stenosis, which is one of the, more severe and common side effects of circumcision. So if that artery is cut, and oftentimes doctors will remove this most pleasurable part of a man's body simply because they think it looks silly or they want it to have a smooth look. So for a purely cosmetic reason, they would remove, a part of the body that no adult man would ever dream of having amputated, if he's not having any type of issues or something like that. I mean, men treasure that spot. So amputating it from an infant is, it's just criminal. But so when they amputate it, if the artery doesn't seal properly, you can have arterial bleeding, and it can happen after the circumcision's finished. If it just pops and it, starts to bleed, the parents might not notice anything until they notice the diapers filling with blood. And infants do die from it. An infant died just recently.
I know, you
down in
sent it
Texas.
to me. Yeah, I couldn't believe that. I couldn't imagine what the family felt like.
It's estimated that about 116 infants die a year from
this.
circumcision. I think that number is probably underestimated, because when babies die from circumcision, they'll say, "Oh, the baby died of, hemorrhage," or, they'll find some other cause to label the death.
Is this
like
an American
thing? Well, he
thing?
bled to death because he had cosmetic surgery. If he didn't
Right.
do the cosmetic surgery, he would not have bled to death.
Right. Is this an American thing, or is this a world thing?
No, it's circumcising infants for these bizarre cultural reasons is purely, essentially American. There's a few other small places that do it.
Okay.
But cutting infants is very American. Europe does not circumcise its baby boys. Russia does not circumcise. China, Japan, most places in Asia. It's cutting baby boys is purely an American thing almost.
Okay.
Also, the Jewish people will circumcise infants on the 8th day of life, but they're not doing it for quote unquote medical reasons. They're doing it for their religious obligations
Right.
that they believe.
What about women? Women or girls? Are women circumcised? What would that be like?
Female genital mutilation is becoming more common in the United States, an underground procedure due to different demographics of immigration. But yes, female genital mutilation, there's 4 different types. And it can range from simply removing a tiny part of the female foreskin, which is the hood of the clitoris, which is very common in places like Malaysia and Singapore and Indonesia. And it's also done in those countries in a pediatrician's office for medical, social, cultural, sexual reasons. All the same reasons we cut boys over here, they cut girls over there.
Gotcha.
When Americans hear about that, they're horrified. And I would say to them, why? They're removing 1/10 of the amount of tissue you're removing from your son.
Yeah.
So that's equivalent. Female genital mutilation also can be just a prick, which is becoming common. And it could lead all the way up to complete removal of all the external female genitalia, the clitoris, the
Like
labia.
in Africa, right?
And in some places, they infibulate, where they sew the vagina shut.
Yeah, I've heard about that, and I mean, I've heard women die from it, even possibly. What's going on? Didn't Michigan recently pass a law because the Muslim culture there, they wouldn't send girls to whoever? It was actually done in an office.
What happened in Michigan is very interesting. They were trying to pass a law to ban that type of female circumcision that I was talking about, cutting the foreskin. But because it was so similar to male circumcision, they couldn't get any backing behind it, because people didn't want to create anything where, you know, people could start comparing it to male circumcision. And then they would have to say, well, boys should have the same rights as girls, because they know, no, boys don't have any rights in this country. You know what I mean? It doesn't matter if you're born totally healthy. If somebody wants to cut off part of your penis, you're screwed. We just do that here. It's one of our weird little things. And it's great to talk about it because it makes you talk about the ethical issues involved. The child is not sick. There's nothing wrong with his foreskin. It's a completely normal, healthy body part that is not likely to ever cause him any problems in his life. Now, if a child were to develop any kind of issue in any other part of his body, say an infection, a small infection, the doctor would prescribe probably, here's an antibiotic cream, put this on for a few days and let's see how it goes. If it doesn't help, they might give you a different cream for a few days, where they say, oh, let's give you an oral antibiotic. They would continue with this, then they would take cultures and, you know, pry into what's causing this infection and how do we cure it. They would not just say, oh, let's amputate your finger, you know, because that's not medicine. And in circumcision, you're removing part of the body that's not diseased at all and probably is never going to have any type of issue ever. You know, if a man ever has any type of issue, it was usually something you could treat with a cream for a few days, and it's likely to never happen again.
Let me ask you this.
So circumcision is simply cosmetic and social.
What is a botched circumcision? What would that be like?
Well, that's funny too, because circumcision is the only surgery you can botch by not removing enough healthy, normal, functional tissue. You know, some parents will say, well, he still doesn't look circumcised. You left too much on. I don't like the way it looks. And they'll go in often, and then the child will be a few years older, and they'll take the child back and put him under sedation. You know, they'll put him under anesthesia and operate again and put the child through all that trauma simply because they want that penis to look like what they think a penis should look like.
So it's not really botched. Should not be thinking of. It's not botched. It looks different from what they wanted it.
Those children are very lucky. You're lucky to be left with as many nerve endings and functional tissue as possible. Yeah. Other types of botched circumcisions can be when they cut off way too much tissue. And often you will see that that's so common in the United States. You'll see, if in pornography, you'll see men who have hair going up on the shaft of their penis. And that's because they had such tight circumcisions that their scrotal hair has pulled up to, make up for what they lost. The penis is not supposed to have any type of, any hair on it. And that's because circumcision removes 60% of the penile skin system. So, the body's trying to, fill it in with the other tissue that's being pulled up. But yes, often that will happen, and they can create a defect in the underside of the penis where the urine will come out below the head if they cut too deeply into the area where the frenulum is. Wow. So there's a variety of different kind of botched circumcisions. Like I was saying, certain procedures, they can, amputate part of the head or damage the penis in ways they did not originally intend to damage, because all circumcisions damage the penis. That's the intent of the surgery. But sometimes they'll say, oh, we didn't damage enough, or oops, we damaged a bit too much, And they won't tell anything to the parent. They'll just return the baby to the parents if there's not some, glaring defect, and that's it.
So who put this into the foreground? Why did people start doing this in America?
Circumcision started, as you stated in the beginning of the show, circumcision started in the United States in the late 1800s because of puritanical doctors who had the idea that masturbation caused disease, that the excessive overexcitement caused by the foreskin, would lead to insanity and would lead to the boy constantly masturbating and him being promiscuous. So the intent was to remove the most pleasurable parts of the penis. And one of the biggest advocates of this was actually a man named John Harvey Kellogg, who was made famous by making Kellogg's corn cereal.
Yeah.
And he intentionally made that cereal very bland to not excite the body and mind.
Really?
So he was a very, a very disturbed man. But that's what the doctors back then believed. They believed that overexcitement of the nervous system caused diseases like insanity, paralysis.
Was he a doctor, though?
Hip and joint disease. I mean, you read the history, it's absurd.
Oh.
But that's how it began, and we just kept coming up with new reasons to do it after we discounted the old ones. Circumcision is snake oil cure-all.
Was Kellogg a doctor, though?
No, I don't believe Kellogg was a doctor.
So
he was an advocate. He was a man.
Okay.
Yeah, no, he was a businessman, I believe, and he also advocated for circumcising girls for the exact same reasons he advocated circumcising boys.
Really?
His method for dealing with female masturbation was to take carbolic acid and to paint the clitoris with it to deaden the nerves. So that was the intention. That's how circumcision for boys started in this country. It's a very disturbing history that doctors will not tell parents about. This is how it began. That's important how it began, because then sometimes things just keep snowballing, and that's what happened with circumcision.
So how did it lead into this, to a huge business that doctors make $300-400 a circumcision, and it's known around the world, well, at least in America, of this is what we do. Oops. Water. This is what we do. Mm-hmm.
Yeah, it just, like I was saying, it's that snowball effect. So he started circumcising, a generation of men back in the early 1900s. They grow up and have children, and all they know now is a circumcised penis. To them, that's normal.
Okay.
Then they will go ahead and continue circumcising, and that's all they know. And they've been indoctrinated with these myths to reinforce the idea that all boys have to be circumcised. And these myths are all simply, are very easy to expose and to discount. But those silly myths are like the foundation of why circumcision continues and why men are so adamant about continuing it. Mm-hmm. It's truly absurd. If you were to try to apply the same standard to any other body part, people would throw you in jail. Yeah. But it continued until the modern day, and doctors continued to attempt to medicalize the procedure and find any type of, benefit they could. So doctors will, they'll study, they'll say, okay, circumcision seems to, maybe decrease the risk of a urinary tract infection. Mm-hmm. Or they'll say, circumcision, they used to say, circumcision will reduce the risk of penile cancer. And they'll tell parents that. And parents will think, oh my God, cancer of the penis.
Is
that's
that
horrible.
true?
Yes, yeah, they'll say, let's circumcise the baby.
So that's not true at all.
Don't tell you.
Yeah.
Well, what it is, some studies have found penile cancer is a condition that affects roughly 1 in 100,000 men to 1 in 200,000 men.
Okay.
It's the rarest cancer. So they're using that as a scare technique to get you to sign up for the circumcision so they can make money.
Okay.
And studies have shown, like in Europe, the penile cancer rate is lower than in America. And in Europe, the men are intact. They don't circumcise in Europe. So, you look at big, populations, it doesn't seem to make sense. Mm-hmm. And in fact, the American Cancer Society has asked the American Academy of Pediatrics, I think it was back in 1996, to please stop saying penile cancer can be reduced by circumcisions. There's not enough data to say it has any benefit, and it's so rare that your baby's more likely to die from the circumcision than to ever get any type of penile cancer. So it's snake oil. They're using hard sell techniques trying to scare parents.
What did they tell you as an RN when you were going through nursing school? What did they tell you? Do they go on this? How is that for you guys?
What I was taught is that the foreskin is the redundant tissue that covers the head of the penis.
Redundant.
And there was, like a slide of the penis. You just see, there's the penis, there's the head, and then there's like a small layer of tissue they show, like foreskin. And that was it. There was nothing about the structures, nothing about its functions and sex, and nothing really about, how the babies would react. That was a surprise. They just, teach you like, okay, after it's done, this is how you care for it. This is the instructions you give to the parents. But no, there's no education at all on like, this is why you shouldn't do it. This is what you should, educate the parents beforehand. Yeah. That's not how things work.
And I asked you earlier, but I mean, once you saw something like this, how does this make you feel? Does a lot of your other fellow, workers or professionals think the same way as you, or everybody keep their mouths shut? What's the known thoughts?
No, there are a lot of nurses. You see this procedure and you're horrified by it.
Yeah.
Now, but in nursing school, when I watched the procedure, they would be very calm, and you could see they're trying to like draw you in. This is no big deal. This is fine.
Like
you know what I mean?
desensitize
So you don't think it's a big deal.
Yeah.
Trying to calm you. You know what I mean? So
Like the
you
baby.
can continue your work as a nurse. Yeah. They're trying to just like get you indoctrinated. This is fine. What we're doing here. You know what I mean? Don't worry about it. Don't worry about how horrible this looks. This is what we do. This is what we do. You know, I've heard some nurses who've come out of it and they've been so excited. They're like, oh my God, I got to do this, procedure, this horrible procedure. Like I feel like a nurse now. But yeah, no, it's really sort of, and yeah, many nurses of course have, a lot of opinions about circumcision. If a parent has already circumcised their child, that will influence, how they look at the procedure. Because no parent wants to think to themselves, oh, I might have injured or damaged my child. That's a very difficult thing for a parent to start to accept, and it takes a long time, and it takes education. With circumcision, people refuse education. That's how they keep themselves like happy and in a good state of mind about what they've done. Yeah. They'll just think back, oh, it's easier. He's too stupid to clean it. I did the best thing for him. And that's how it continues. It's sad.
Well, Justin, we're already at that hour point, which this flew by, and you're coming back on tomorrow. We have so much more that we need to go into on this of exactly, what's going on, how to do something about this, how we're going to change all of this, and so much more that, you're going to want to listen in on so we can all learn together, because I know when I first spoke to you, this was so jaw-dropping to me. I had no clue. I mean, I heard the controversies a few months ago or even in the last few years, but I just had no clue how big this was and what a barbaric, terrible thing it is to do to our children and our babies, So thank you so much for coming on and sharing this so far, and I'm really excited to have you back on tomorrow night. Did you want to say anything before we get going here for tonight, just to leave off with our listeners?
Yeah, so I would just like to say, education of new parents works. Sometimes all you have to do is show them the procedure video, and they'll say, oh my God, I had no idea that this is what circumcision was, because nobody told me. You give some basic information in a kind way to parents, and they don't want to hurt their children. Parents are doing this because they were taught this is best. But just some basic education, just listening to a show like this, it starts to expose, how kind of cultish what we're doing is. And, we're deprogramming people and, kind of educating them how to think humanely
Good
about
word there.
our boys, too.
Yeah, deprogramming, because you know what? It's been etched in our brains since we were literally babies, basically, right? Because they did it to us eventually, at first. So since we've been babies, It's been put into our minds. Our parents did it, our grandparents did it, everybody did it. It's in the news, it's in the media. It's all we know. So again, thank you so much for coming on tonight. I'm so excited to have you on again tomorrow night. And we're going to go into this more, and you're not going to want to miss out tomorrow night, because we are going to talk about some very interesting stuff that you won't want to miss, and tips on, what is right, how can we change things, and what are we going to do about all this, and I think we'll give a little bit more direction on also of if you are one way or the other, or you're leaning on everything. So, Justin, have a great night. Thank you so much. I appreciate it again. Are you there? Oh, I guess Justin's off. Okay. Well, Con Nation, thank you so much for tuning in tonight. I hope you enjoyed listening to Justin. Man, this stuff is, seriously, I was crying tonight. It was so hard for me to hear. I couldn't imagine if I was a parent in the room with my little baby boy being cut like that, with nothing or just a little layer of, whether they put sugar in their mouths or a little layer of like lidocaine or something on, their penis. I just couldn't imagine doing that. It tore me apart. So I just hope that we possibly have been giving you some information. Maybe it will just make you think a little bit and make you want to look into things more. I hope you'll join us back tomorrow night, because we will go way more in depth on this. We have a lot of good stuff that you're going to want to come back in for. So I hope you have a great night, and we'll see you again tomorrow night at 8, 7 Central. Night, Call Nation.
You've been listening to Conspiracies Against Wellness with Janelle Elgoway. Join us tomorrow at 8 p.m. Eastern to get in on the conversation. The opinions expressed on this program are those of the host and callers and not necessarily those of EXG LLC, its employees, or sponsors. I'm David Shifter.
Copyright 2017 by EXG LLC. All rights reserved.